Our next speaker will definitely highlight some of those points, which is the human dimension of the circular economy, and particularly as it relates to health. So I'd like to introduce Dr. Gary Bota, who's the chair of Climate and Health Taskforce of Northern Ontario School of Medicine and the invited chair of the Ontario chapter of the Canadian Association of Physicians for the Environment. The floor is yours, Dr. Bota.
Thank you very much. And thank you, MP Mark Sray, for inviting me here today. I'm just going to get my slides up and going. Okay, good. So first, I would like to acknowledge that I'm on Robinson-Huron Treaty Territory, and the land on which I'm sitting is a traditional territory of the Atikameksheng Anishinaabe peoples. I'm going to start with a few stories. Having been an emergency physician for the last 38 years, I've got lots of stories. These are some of the tame ones, but I'll give them anyways. So about 6 years ago, and they are all linked, by the way. About 6 years ago, I was working a shift in the emergency department. A young gentleman came in with unusual symptoms and a rash that I'd never seen before. After doing some chatting with colleagues, it turned out it was the first case of Lyme disease I had seen here in my Northern Ontario city of Sudbury. In 2016, I was out for a hike on our local trails behind Laurentian University. It was a hot summer day, and you may or may not know that 2016, along with 2020, were the two hottest years that have been recorded globally. In any case, I came across a woman standing over her partner. They'd been out for a hike. He had gotten confused, collapsed, and I found him lying unconscious on the ground. And it took us about 2 hours to get paramedics into the area and get him out of that location. A couple of years after that, in 2018, we had a particularly large forest fire in our region, the Parry Sound 33 fire. That's the picture top left on your screen. And throughout the course of that summer, while the fire raged, we saw an unprecedented number of patients presenting to our emergency department with asthma attacks, and this has included children, and particularly children. Some places that had had recent fire events actually were running out of their inhalers. And even once the fire was over, people were coming in with mental health problems, severe anxiety, senses of loss. They'd lost their places that they'd had forever, their homes and such. This past summer, we had the opportunity, my wife and I, to visit one of our children in Vancouver for a week at the end of the summer. That's the picture bottom left of Vancouver. Because of the unprecedented forest fires taking place on the West Coast, from California through Oregon, and the smoke and particulate pollution that was coming up the whole West Coast because of that. And of course, in the center of the screen is something we all recognize by now. This is our infamous COVID virus. And that has been, on top of all these things, incredibly disruptive over the past several months. So what do all these things have in common? Well, they're all related to climate change. So starting in the north, we've found that food patterns have changed, winter travel patterns have changed, hunting has changed. On the West Coast and in Ontario and elsewhere, we're having increasing number of wildfires causing asthma, evacuation from homes, exacerbation of other diseases. Across the West, we've had unprecedented floods and the damage associated with those, and droughts that are affecting crops and the yield from crops. The micronutrients in crops are starting to fall. Kids are getting zinc and other deficiencies. We're seeing more people with allergies. The pollen season's getting longer. When you have a flood, we're getting a lot of flooded basements, molds are growing. And so we're seeing a lot of disease related to that. As I mentioned, we're seeing tick-borne diseases now at higher rates than we've ever seen them. Heat-related illnesses. My collapsed person on the trail, he was a heat stroke victim. And every year now we're having 2,000 to 3,000 people per year affected by heat and dying from heat in this country alone. So lots of health-related problems related to climate. I'm going to just take a minute and talk about the concept of planetary health. In the past, we always thought about health as human health. But what we're finding now, and I refer you to the bottom of my image there, is we really live in a nest that depends on the environmental determinants of health. We need clean air, we need clean water, we need clean food, and we need a stable climate. And if we have all those things in operation, then we can build up our society, our social, what we call our social determinants of health. We can create an economy, we can create education, we can create good housing and food and social justice. And if everything's working well, we can do really advanced things like build sophisticated healthcare systems. And we've done that. The problem is our nest is starting to crack. I don't know if it's affected anyone else, but the crack caused by COVID has in my life been very disruptive over the past year. So why is this happening? Well, I think we really have to remember that we've lived in an environmental sweet spot for the last 11,000 years since the start of the agricultural revolution. But what's happening now? And it's kind of funny because I made this slide about 4 years ago. It's no longer applicable. We're not at 1.1 degrees Celsius anymore. This year, the globe hit 1.2 degrees Celsius above its pre-industrial times. In Canada, it's going up even faster. In the far north, it's going up 3 times as fast. That's a steep curve. I don't know how you get 3 times as fast as that, but that's where we're at. And why is this happening? Well, as you know, to paraphrase President Bush, it's not the economy stupid, it's the carbon stupid. These are the changes in carbon dioxide over the last almost 1 million years. And quite frankly, if I saw vital signs that look like this on a patient, we'd be calling an emergency. We would be doing everything we could to try to change the slope of that curve. You can see how steep it's going at the end. So at the end of the day, what we're thinking more and more in medicine is that climate change really is the biggest global health threat of the 21st century. COVID's been bad, but really COVID's nothing compared to what we're seeing from climate, even starting now. Fortunately, climate change is also the biggest global health opportunity of the 21st century. If we create clean energy, we end up having a much better way of, our asthma rates go down, our heart disease rates go down, it's generally healthier. If we create a sustainable and active transportation system with walking, biking, we know that the incidence of diabetes goes down again, heart disease goes down, obesity goes down. And the same applies with creating a sustainable food system and healthy diets. And if we do all these things right, it's actually been estimated that the economic savings, in other words, we're going to have to spend less on healthcare, more than makes up for the cost of transitioning to a clean society. So where does healthcare actually come into this? Well, we have a high level of healthcare, as you can see on this graph, that's measured on the left-hand axis. But we spend a lot, it costs us a lot to get there. Per capita in Canada, there's about 1,200 kilos of CO2 created per capita to run our healthcare system. That's a lot of CO2. We create a lot of waste in our healthcare system as well. About 26 pounds of waste per day per patient. About 30% of this gets recycled at this point, 60% goes into the garbage, and about 10% is biological waste, and it usually gets incinerated. So where does all this come from? Well, the country doing the most on this right now is in the UK. The UK, through their national health system, has decided that they are going to reduce their waste and their carbon footprint by 80% by sometime between 2028 and 2032. They're not entirely sure how that's all going to happen, but they're starting to measure. And what they're finding is that within the national health system, and Canada's fairly similar, I suspect, they've done other countries as well, that's probably our closest matchup, is waste and water account for about 5%. Using particular gases, and I'm going to talk about those in the operating room, accounts for about 5%. There's a lot of travel we do now, both of patients and staff. And so as we transition to virtual care, which we're starting to do in some instances, we're going to have an impact there. But fully 60% of our carbon emissions in the healthcare sector come from the supply chains. And these supply chains are extensive and worldwide. Drugs, surprisingly, account for a surprisingly large amount of our carbon footprint through the manufacture of drugs, the distribution of drugs, and the taking of, in some cases, the right drugs, sometimes the wrong drugs. So there's lots of work that can be done there. So a couple of quick stories, and we have to look at what we're disposing of, how we're procuring things, and what our values are around this. So on the top of your screen there is an anesthetic machine. And an interesting local story. There's a physician, Dr. Mathur, who just happens to be Sophia, who you saw earlier in our presentations with the FFFs. This is her father. He's an anesthetist at our hospital. And he started looking into the drugs they use to put patients asleep. And there are various volatile anesthetics, gases that get used. Turns out one of them is a particularly nasty greenhouse gas. Does it offer any advantages? Some people thought so, but it's really very minor, the advantages that gas adds to any patient's outcome. So through his education, advocacy, the local hospital has just about gotten rid of that gas. The result of removing one gas like that from the system turns out to be the equivalent at one hospital of driving 3 million kilometers per year. So you can make huge differences by looking at what you're using, in this case, anesthetic gas-wise. Now, are there other ways of handling it? Yes, some places are taking those same gases, and again, through the circular economy lens, scrubbing those gases, cleaning them, and reusing them. So one can do that with these various gases, and there are other ones that are in use. Now, a story that isn't so good, perhaps, is it the right thing to do to take your, on the top right, sorry, I'm just getting particular chats. Oh, 2-minute countdown. So we're going to skip that. What I'm going to do very quickly is say, to have sustainable health care, we need less waste and more health. And more information is coming out about that, but we need more education around this theme. Fortunately, we do have a Canadian Coalition of Green Healthcare. They do put out an annual Green Hospital Scorecard, and there are winners in the areas of energy, leadership, and waste, among others. One thing that healthcare can do, though, is we know we need rapid social change. You saw the steepness of those graphs about where we're heading temperature-wise. But to move from business as usual to a decarbonized state, we need more social tipping points. We have our FFF students out there, but we need educated healthcare individuals helping, because healthcare workers are trusted messengers, and we can help you and virtually all industries get through this. So let's all work together. We got lots to do. There's lots of things we can do within healthcare, and healthcare workers can do a lot to help you as well. Thank you.
Miigwech, Gary, thank you so much for your wisdom, your knowledge, and your expertise in your presentation. I too want to acknowledge the wealth of knowledge that you have. You spoke to all our relations, and I think that's one of the elements as a human family. We need to identify and go back to our original teachings that are rooted in all of the elements that Shkaakmakwe provides to us, and all our relations then speaks to the plant life, the animal kingdom, the four-leggeds, the crawlers, and the flyers, and how that impacts that circular economy. And you honing into what those impacts can look like from a human perspective. So Miigwech, very much for your time and your wisdom. Your presentation was filled with so much knowledge, and I'm certain that there'll be plenty of questions at the end of our session today. So Miigwech, Gary, for your time. It's now my pleasure to introduce Peter Xavier, Vice President of Glencore, Greater Sudbury Operations, and Chair of Ontario Mining Association,